Hello everybody! Welcome back to another Live with NUNO NINA. Today we are going to talk about a very serious condition that has become a worldwide pandemic, metabolic syndrome. Metabolic syndrome is characterized by various medical conditions, including dyslipidemia, hyperglycemia, insulin resistance, hypertension, and obesity. These risk factors play causative roles in the development of atherosclerosis, which further leads to coronary artery disease, stroke, myocardial infarction, and of course, increased mortality. NUNO NINA will then explain to us what happens in an obese body.
Yes, Rita. Hi, Rita. Hi, everybody. So let me try if I can explain how an obese body works 24 hours a day. So first, there is a spike in insulin which stresses the pancreas and the adrenal glands, causing stress hormones to flood the body and adrenal glands to overwork. Second, the thyroid is stimulated and accelerates the metabolic process in the liver. And at this moment, the liver increases its anabolic efficiency too much, metabolizing sugar and accumulating fat. So an increase in the level of leptin. And what is leptin? Leptin is a hormone synthesized by adipocytes occurs, and leptin resistance occurs. So at this point, the body has already retained a huge amount of toxins, with the liver being the sole processor of these lipotoxins. The insulin resistance at the beginning of the day is now causing leptin resistance, bolstering the endocrine and the metabolic effects on the dynamics of obesity. And Rita and my friends, this is how the body of an obese works 24 hours a day. This is the cycle, and this is so, how can I tell you? Because it's so strong if you understand all this process. And if you realize that, you can see that, I don't know, but how strong for our body is this cycle that you keep all days, all the time. So I will ask Rita if Rita have amazing studies to show us about not only about this that we are talking now, but also maybe we have a solution to stop this cycle. So Rita, please.
Okay, Nuno, thank you. So we all know that modifications to diet and lifestyle, including calorie restriction and exercise, are currently recommended, and if implemented can be effective. There's no doubt about it. However, stresses of daily life, lack of time and sufficient motivation are often cited as reasons that prevent people from making sufficient modifications until after they develop symptoms. So what can help a person in this situation? Molecular hydrogen has been demonstrated to attenuate oxidative stress, improve cellular function and reduce chronic inflammation, many of which are associated with the pathology and etiology of metabolic syndrome. I'm going to show you some interesting studies, but before that, it's important to explain that quality of scientific evidence is not all equal. Preclinical research, in vitro or animal studies, do not have the same relevance as human studies. Preclinical and clinical studies have shown promising effects of hydrogen-rich water on specific features of metabolic syndrome. The two studies that I bring you today are randomized controlled trials, whose quality of evidence is the highest, not considering meta-analysis and systematic reviews that do not exist on this topic. Okay, let's start. In this first randomized controlled trial, 60 subjects, 30 men and 30 women with metabolic syndrome were analyzed. Subjects participated in this study if they met at least 3 of the 5 inclusion criteria, including hypertension, diabetes, central obesity and dyslipidemia, low high-density lipoprotein, and high triglycerides. If you have or know someone who has at least one of these 5 problems, pay attention. Throughout the study, all subjects were asked to maintain the same lifestyle. They evaluated the effects of 24-week intervention, 6 months, that's a long time, with hydrogen-rich water on body composition, blood lipid profiles, and inflammation biomarkers in men and women with metabolic syndrome. So what results did they get? Hydrogen-rich water significantly reduced blood cholesterol, triglycerides, and glucose levels. And more, H2 tended to promote a mild reduction in body mass index and waist-to-hip ratio. In conclusion, hydrogen-rich water might have promising effects as a therapeutic modality for attenuating risk factors of metabolic syndrome. Okay, the second study was conducted only in women. They evaluated the effects of H2 intervention on body composition, hormonal status, and mitochondrial function in 10 middle-aged overweight women. The first study that I presented is more recent and better, not only in terms of sample size, 60 subjects instead of 10, but also in terms of intervention time, 24 weeks instead of 4 weeks follow-up. But let's see the results obtained in this second study. They saw that H2 treatment significantly reduced body fat percentage and arm fat index. Significant drop in serum triglycerides after H2 comparing to placebo. And more, fasting serum insulin levels dropped by 5.4% after H2 comparing to placebo. So what can we conclude? We can conclude once again that it appears that orally administered H2 might be a beneficial agent in the management of body composition and insulin resistance in obesity. And now you may ask, okay Rita, but where can we get hydrogen water? This is where the CellPower Water Bottle comes in. It is a device developed by NUNO NINA, which you can purchase through our website and which allows you, in a practical and safe way, to obtain hydrogen water anywhere. You will find many other bottles on market, some 6 times cheaper. But there are very important things you should know about. Most importantly, these bottles end up producing undesirable compounds that remain in the water. I invite you to watch the video that shows the unique features of the CellPower Water Bottle. And that's all for today. Thanks for watching. Leave your questions in the comments below and see you in the next video.